over social media, people are sharing photos and selfies of them getting the COVID-19 vaccine. To that, I say right on. And people are really excited about the light at the end of the tunnel, and that light is the vaccine that's going to get us to herd immunity. Now, at the time of this recording, I haven't seen any hospitals making the shot mandatory for healthcare professionals. And enthusiasm and compliance has been really high, as it should be, but with everything that's at stake, I want to ask you, do you think getting the COVID-19 shot should be a requirement for healthcare professionals?
I guess my first question is, does it even need to be required? The president of the American Medical Association said she was confident that once physicians saw the evidence behind the vaccine, that they would go out and get the shot. Well, they have, and they are. And I think this is true with all healthcare professionals. Case in point, a lot of you saw that video of one of the first people to get the shot, the critical care nurse in New York City. I love what she said. She said, "I trust the science and I guide my practice by it." And since then, thousands of healthcare workers have followed suit, have shared photos and facts about the vaccine and debunked misinformation.
On the other hand, there unfortunately is still some reluctance within the medical community about the vaccine. Whether we like it or not, that's why we're talking about this. Only 1/3 of US nurses said they were willing to go and get the shot, according to an October survey. Now granted, that was a little bit ago, but more recently, per the executive director of the Association for Immunization Managers, state and local health departments are reporting only about 50 to 70% of healthcare workers said they were going to go and get the vaccine. In early December, I saw a Medscape article about vaccine side effects, and I noticed the comment section was littered with rants from healthcare workers talking about why they were not going to go and get the shot. Now, hopefully all the recent data has swayed some of these people, but who really knows? Plenty, if not every, major healthcare organization stands by the science of the vaccine and trusts it, including the FDA, the CDC, ACIP, the American Hospital Association, the AMA, the AAP, the AANA, the list goes on. I mean, maybe hospitals are just waiting for full FDA approval rather than emergency use authorization to mandate the shot. Maybe healthcare systems just need more time, more data. Can you imagine working in a COVID unit? One of your colleagues refuses the vaccine, doesn't have the little COVID shot sticker on their badge? Maybe a mandate would just remove the personal politics from all of this by sending a clear signal saying, we want our workers to get the shot, kind of like they do with the flu shot. But maybe a mandate that's rushed would cause more mistrust and division. And the legality of all this is a whole other topic. But I did see a recent article from healthcare attorney Carolyn Bupert that made me think and raise some questions like what happens with workers' compensation if a hospital employee refuses the COVID-19 vaccine and then goes and gets sick with it. And I know we're still waiting to see what happens with transmission after getting vaccinated, but theoretically, would a hospital be liable if an employee refuses the vaccine and then goes and causes an outbreak? It's a lot to think about. We play a crucial role in building public trust, not only with the vaccine itself, but with the entire process that got us to approval, from research to review. And maybe this entire discussion will fade in time and healthcare workers will unanimously march out and get their shots. Or maybe it'll become more complicated and it'll evolve and national organizations will have to come out and support a mandate. Hopefully in the meantime, we won't have to have difficult conversations with vaccine hesitant peers. But time will tell. For now, what I want to know from all of you is if you think the COVID-19 vaccine should be mandatory for frontline healthcare workers. Comment below and don't forget to share your vaccine picks with the hashtag MyCovidVax.